Hello and welcome to another episode of Keeping London Healthy. My name is Dr. Mario Elia. Today we're going to be talking about eye health with ophthalmologist Dr. Hutnik, who will be answering all of our questions about red eye, dry eye, cataracts, everything you can name about eye health. So we'll be back to Dr. Hutnik right after this message. All right, welcome back. Again, I'm pleased to be joined today by Dr. Cindy Hutnik. Dr. Hutnik is an ophthalmologist here in London. She's a professor and chair of the Department of Ophthalmology at Western University, and she's an ophthalmologist in chief at the IVI Institute here in London. So, Dr. Hutnik, thanks so much for joining us.
Well, thank you, Mario, for the invitation to be part of this outstanding series that you've created, as you've really had quite an impact on bringing an awareness about health and well-being to the community. So I'm so happy that you thought about eyes, because sometimes eyes are neglected when we talk about health and well-being.
Absolutely. And there's so many questions and kind of misconceptions that patients have about their own eye health and kind of the system and kind of who they should be turning to for certain things. So I'm really excited to have this chat with you today. So let's start off with a kind of a basic one that I think patients don't necessarily truly understand. What is the difference between an optometrist and an ophthalmologist?
You know, Mario, that actually is an important question, because many people, not just patients, don't really understand the distinction. There's actually three different types of people that deal with eye care. They are ophthalmologists, and optometrists, and opticians. An ophthalmologist is a medical doctor who has graduated from medical school. So the way a patient can determine that is to see if there's an MD after their name. To become an ophthalmologist in Canada, generally you have to complete about 12 to 14 years of postgraduate education, of which 4 years of that is medical school. When you pass all of your exams, you become licensed to practice both medicine and surgery. So if you watch some of those medical TV shows, an ophthalmologist is someone who has done medical school, some form of an equivalent internship and a residency. And then even some ophthalmologists go on to an additional 1 to 2 years of training, which is called a fellowship, in which case they subspecialize and they become targeted in certain disease areas such as glaucoma, retina, cornea, pediatrics, oculoplastics. So that's the ophthalmologist. An optometrist is also an eye care health professional who has graduated from the School of Optometry. So they have the distinction of an OD instead of an MD after their name. They also will train for a period of time ranging anywhere from 6 to 8 years, and they are licensed to practice optometry. They tend to be what we call our primary eye care professionals, ranging from what we historically think of as vision testing and correction, but they now have an increased scope in which they are able to diagnose, treat, and manage eye disease. They are experts, definitely, in prescribing and dispensing corrective lenses, but they're also very adept at screening for eye disease, prescribing medications. And as of April 2011 in Ontario, they are able to prescribe quite a few ocular medications that are quite helpful. Opticians, they're also experts in terms of the technical side. They are trained to design, fit, verify eyeglasses, frames, and contact lenses based upon the prescriptions that are given to them by optometrists and medical doctors.
I'm glad you brought up opticians, because I find, with our patients with diabetes, we'll often ask them to be seen by their optometrist once a year for an exam. And I often find that patients who've seen their optician for maybe an updated lens or something, they think that they've seen an optometrist for a dilated exam and follow up, but they've actually not. So it's really important. I'm glad you brought up that distinction, and I'm also glad you brought up kind of the optometrist as the primary care kind of, because patients will often see us with an eye complaint asking for a referral direct to an ophthalmologist. And we'll often direct them to see their optometrist first. And many kind of, I think, falsely assume that they're receiving inferior care with that and that they should be seeing the ophthalmologist directly. Can you speak to that a little bit in terms of, capacity of ophthalmology to be dealing with kind of primary issues and kind of where we see the optometrist kind of fitting in? And you mentioned a little bit, but just a little bit more about optometrists.
We have in recent years seen an evolving scope of practice on both sides. Some opticians within their practices often have optometrists on board to actually do limited kind of screening eye exams for glasses and contact lenses. So opticians have expanded where they go to a little bit more than what has been in the past, but certainly the government of Ontario has expanded the scope of practice for optometrists. So historically, you're right. Most people thought of optometrists as the place I go to get glasses, but certainly they have the skill set and the education to screen for eye disease and actually begin to manage a number of eye diseases, certainly in the early and even moderate stage. As I mentioned, something called the TPA came out in several provinces, and it was really a therapeutic pharmaceutical agency policy that gives optometrists the authorization to prescribe antibiotics, anti-glaucoma medications, as well as others. So they certainly are our primary care doctors and very capable and competent of doing so. As you mentioned, patients cannot directly refer themselves to an ophthalmologist, but they can make appointments for themselves in an optometric office. And as you correctly said, patients can call in, but they can also be referred to optometrists by other optometrists, by family doctors, and even ophthalmologists will sometimes recommend that a patient see an optometrist because they're the experts in terms of certainly the whole vision care of refraction. They're probably experts in treating severe dry eye. And you mentioned capacity, once a patient has a stable chronic condition, such as glaucoma, ophthalmologists actually recommend that patients go to their optometrist and see them on a regular basis, follow along. They are well aware of what the red flags are and when they should come back to see an ophthalmologist. So I'm a big proponent of what's called an intercollaborative model of care that involves the patient, the ophthalmologist, the optometrist, and the family doctor. We're really a team when it comes to dealing with eye care.
There's been a few situations I know in my practice where I've had patients who've been followed by an ophthalmologist who has subsequently retired, and the patient has come in to request a referral back to another ophthalmologist. And my response to them is often, I'd actually like them to see their optometrist first for an evaluation to really determine, do they actually need that referral to an ophthalmologist? And I'll often get pushback from the patient because they're so used to being seen by the ophthalmologist, but I'll explain to them that often they had a chronic condition. And if the ophthalmologist who was retiring didn't specifically make arrangements to be seen by an ophthalmologist, there is a chance that this patient is kind of chronic enough that the optometrist may be most appropriate. I'm not sure if you kind of have experienced similar situations with that kind of back and forth, especially with the retiring ophthalmologist. Yeah.
And Mary, I'm smiling because chronic also means stable. And stable, correct, I always say to my patients, I'm going to say the S word, and the S word's a great word. Your condition is stable, and for that reason, you will be very well followed by an optometrist. And you bring up another point that things have evolved. So if an older ophthalmologist is retiring, chances are that at the time there wasn't enough capacity in the system for ophthalmologists to follow patients along. But what we really need to do is build capacity to have access to care to ophthalmologists when they're needed. So when the condition becomes advanced, when there's a more complex eye disease, when they need some sort of surgical intervention. And yes, I do have experience because I put my hat on as the chief now. If you look at healthcare resources across the province for all doctors, ophthalmologists included, the doctor to population ratio is becoming more and more concerning. So the capacity in the system for every patient who needs to see an eye care professional, it just can't be done by ophthalmologists alone. There's just not enough ophthalmologists to see the number of eyes that need to be seen over time.
There's been some changes in kind of how government funds eye care over the last few years. Are there things now that are followed by an optometrist that no longer require to be followed by an ophthalmologist? I'm not sure if there's any specifics around that.
One of the reasons that attracted me to ophthalmology was the fact that it's so technologically progressive. So we have the ability through some of our diagnostic tools to look at structure and function in detail in a way that we've never been able to before. So we can detect eye disease very early, and that really is in the realm of the optometrist. They have the skill set, the knowledge, and the instrumentation that will allow them to see structural and functional changes and be able to distinguish, is this healthy or is this unhealthy, and should something be done? The thing about government funding, sometimes it lags behind the science. So even though we know we can, and even though we know we should, based upon clinical practice guidelines, sometimes the government won't completely cover the cost of all of those tests. And it really is confusing for patients because they sometimes wonder, is this a money grab, or do I really need this test? And I can tell you, I just got back from a meeting on the weekend. It was a Canadian meeting. There's no question that in terms of some diseases like glaucoma, which is called the silent thief, the more testing you have done, the earlier you get it done, and the earlier you start treatment, the better you will have eye health for your entire life.
And we'll be right back to talk with Dr. Hutnik a bit more right after this. All right, welcome back. And we're joined today by Dr. Cindy Hutnik, ophthalmologist, to talk about eye health. We'll move on to screening. So I guess the first question we'll ask is, how often should an otherwise healthy patient be screened by other optometrists?
We'll separate kids from adults. So, Mary, do you want me to talk about what's recommended for children first? Or
Yeah,
what's
sure. Let's go kids first. Yeah.
Family doctors, as you know, you do your well baby checks, and you know very early, you folks know how to just baseline look. Is there a clear view to the back of the eye? Do you see that nice red reflex, or is there something blocking it? Most pediatric ophthalmologists recommend preschool by the age of 3 that a child who looks otherwise healthy should go for a screening eye exam with an optometrist, and they're very good at that. So age 3 is a good time. And the reason why you want to get the child in there early is a child's brain is very smart. If that child has either something blocking the vision, if their eye's a little bit turned in or turned out, or if they actually have what we call a refractive error, which means they need glasses, but it's hard to tell because they're 3 years old. Kids' brains are really smart. They actually turn off the images coming into that eye, and their brain develops something called amblyopia. Amblyopia is very treatable if caught before the age of 10. So, and now, we used to say that once they go to school, well, the teacher's going to catch it. Mario, we're now in a digital era. Gone are the days of the chalkboard and printed material. Now that we have digital computers, you might actually miss, and the teachers may actually miss, that the child is not seeing because they can change the size of their own font. So I think kids need to start screening at 3 and really should be screened, if otherwise healthy, minimum every 2 years by an optometrist, because kids won't complain. And nowadays with digital era, teachers might miss it.
Yeah.
In case of adults, if you look at the guidelines, they generally say by the age of 40, a person should start going to an optometrist. And the reason is 40, because usually one of the things that happens as we get towards 50 is we start needing reading glasses. So we actually say before that even, try to get motivated to see an optometrist, because there are a few conditions, especially glaucoma, which you would have no idea you have. You can lose up to 2/3 of your nerve function and not even know it. That's why it's called the silent thief. But again, we're in the digital era, and even young adults are starting to show up with eye conditions earlier. Screen time, a lot of dry eye. There's something called LASIK refractive surgery that more and more young people are getting. So people can be more prone to certain eye diseases earlier than what was historically thought of. So certainly by the age of 40, and if you really want to be on top of things, even by the age of 30, starting to go to an optometrist for a good comprehensive eye exam.
And frequency in adulthood for again, people without any other condition.
If you're otherwise healthy, every 2 to 3 years, but really put it on your calendar, because those years click by really quickly. What I personally do is, believe it or not, I'm an ophthalmologist who brings my family to an optometrist every 2 years. And I started bringing my son when he was a teenager. We do it during summer holidays. We do it as a family. And little things can be picked up. Even size of eyeballs vary. I say they're like underwear, small, medium, and large. And even smaller eyeballs, which are physiologically made smaller, they're prone to certain conditions such as acute angle closure glaucoma. So the earlier these things are picked up, the earlier they can be managed so that crisis stages are avoided.
Now, are there certain medical conditions that would necessitate someone to be seen by their optometrist for screening more often than every couple of years?
the eyes are the window to the soul, truly. It's one of the only places in the body, if not the only one, where we can see blood vessels straight on, not covered by any tissue. So people who have diabetes certainly are at more risk for eye disease. People with high blood pressure, certain types of arthritis can cause certain types of specific eye diseases, and even the side effects of some of the medications that we use to treat other things in the body can actually have side effects that affect the eye. So I tell people, and what you're hitting upon here is what's called risk factors. So by the age of 3, if you're otherwise healthy, if you're a child, by the age of 40. But for example, if you have a family history of eye disease, and a lot of people in their 20s and 30s and 40s don't really talk about their grandma and grandpa and their uncles and aunts. But if you have a family history of eye disease, it's good to know that, and you should probably start being seen early. If you or a family member has a history of diabetes, high blood pressure, certain types of arthritis, those are what we call risk factors, and they probably mean you'd benefit from going in a bit earlier to get screened.
I'm asked by patients frequently who've seen their optometrist, they've been offered this kind of, and you alluded to it a bit earlier about kind of more expensive testing that's available. What should patients be asking to determine whether this kind of testing would actually be helpful for them?
As I alluded to before, the science and the medicine tends to justify the use of both structural and functional testing. So functional testing is our classic visual field testing. Structural testing is something that we now do routinely called OCT, ocular coherence tomography, where we can actually in vivo, non-invasively look to see how the retina is doing at each individual layer of the retina. And I can have a little eyeball here. The retina is the tissue at the back of the eye, like film in the camera. So it's recommended that we do these regularly, because as I mentioned, in the case of glaucoma, you can lose 2/3 of your vision without even knowing you have it. The thing about OCT, for example, though, it's not covered by the government. The government does not always cover the testing or the testing frequency, which is recommended by the science. So the way it works in Canada, so there's something called the Canada Health Act, where patients really are not supposed to be paying for things that are covered. But there also are a number of things that are not covered, which patients can pay for. And the key to that is it should be explained to the patient what the test is, what the value is. It should be made optional. Patients should not be coerced into paying. And basically, it should be the patient's option as to whether or not to pay. But certainly in the case of the structural testing, which is OCT, it's worth its weight in gold. So it's not covered by optometry. Optometrists are able to do it. It really can uncover diseases in the very earliest stages. And again, allow the optometrist to start treatment, and or if it's really concerning, sending that patient to an ophthalmologist to be seen and treated.
For a patient who's experiencing a red eye, what should they be thinking about and kind of looking for in determining whether they should be seeing a health professional for evaluation of that eye?
There's 3 primary reasons why people will call in with an eye problem. Either the eye is red, or the eye hurts, or they can't see. Those are the 3 reasons. So you and I both deal with that red eye. And I'm going to put red eye into 2 categories. The first red eye that actually causes a lot of concern, but has absolutely no foreboding of any terrible eye disease, is called a subconjunctival hemorrhage. And the reason why people call in, so the white of the eye called the sclera, a little tiny broken blood vessel breaks just outside of it, but underneath the gooey gummy tissue called the conjunctiva, and it looks so dramatic. It's red, very red, it's blood red. That is basically something that will resolve on its own. It can be due to a good sneeze, a good cough, it could be vomiting, and a lot of patients actually rub their eyes at night when they sleep so they can wake up with this. So that type of red eye probably just needs a little bit of reassurance on the phone. And if a practice has the ability for a patient to take a picture and send it in, and that's something a practice has adopted, patients can be reassured that that's going to go away on its own. The other red eye, which is very common, is due to inflammation. And inflammation in general is our body's response to something it doesn't like. We can be inflamed anywhere. So inflammation is redness, swelling, pain generally. And the thing about the eye, it's the final common pathway to so many different things. Inflammation can be due, and a red eye can be due to an infection, can be due to allergy, can be due to a sudden rise in eye pressure called acute ankle closure glaucoma, can be due to severe ocular surface disease and blepharitis. And the last reason is a term that doctors often use that patients don't like called idiopathic, meaning no doctor or scientist in the world has figured out why your eye is red. The most important thing is that we distinguish between those. The typical pink eye, which happens in adults, is usually viral, and the virus is usually the most common cold virus, which is adenovirus, and it tends to quickly jump to the other eye. It as well is self-limiting. If you were to do nothing, it would go away on its own, but patients are uncomfortable. So whenever we talk about managing any eye condition, we talk about conservative, medical, surgical. Conservative in the case of your typical pink eye are maybe warm water compresses, maybe cool water compresses, lid hygiene, a topical over-the-counter artificial tear to flush away whatever virus may be there. Sometimes, Mario, I learned this as a resident, giving them a 5-day course of a topical antibiotic. Actually, it's not specifically treating the virus, but maybe the excipients or the vehicle in which the medicine is dissolved just makes the patient more comfortable. So your typical pink eye is usually mild, self-limiting, will go away on its own. But again, treating the symptoms of inflammation will make the patient feel better. Other red eyes, what are the concerning signs? Well, they can be caused by other things. If an adult gets an eye that's very goopy with a lot of mucousy discharge, it's usually a bacteria. Relatively unusual in an adult compared to a child. And the things that you have to consider are something which is on the uptake right now are the sexually transmitted diseases. So gonorrhea, syphilis, and chlamydia. So if an adult comes with a superfluous amount of discharge in one or both eyes, that discharge probably should be swabbed, should be sent to the laboratory. And again, there are specific treatments for those conditions. So we often don't think about, and sometimes we don't often like to talk about things that are below the chin, but they certainly can affect the eyes as well. The other main cause of red eye, which tends to be unilateral, and again, I'm seeing a lot more now than I did as a resident, are the herpes viruses, herpes simplex and herpes zoster. Again, we have to be careful. When we diagnose herpes simplex keratitis, that's the cold sore virus. That's the one that affects people above the belt. And I know that whenever I have a parent with a 12-year-old or a 13-year-old and we're throwing out the diagnosis, I really make sure that I say, this is the one that's the cold sore virus. It's the above the belt one, because parents can become very concerned when they hear herpes. The thing about this herpetic virus is it's everywhere, it's common, it tends to cause the redness on one side. Up until now, there were only oral medications to be prescribed. They can be prescribed by an optometrist, a family doctor, or an ophthalmologist. But I was really excited to hear at the meeting that I just attended that in October, there's going to be a topical form of ganciclovir. It's an ophthalmic gel that can be applied directly to the eye. And I think it's going to make things much easier. So that's really an exciting and I think well-needed step forward rather than taking a pill. The last thing that happens, and I know you've seen it and I see it. So when you get symptoms like that, but you start getting a rash on particularly the forehead and back into the scalp, that's called herpes zoster ophthalmicus. And it's basically shingles that have targeted the area of the eye and the forehead. This can go on to become really severe. So it can affect everything from the eyelid to the front of the eye called the cornea, to inside the eye called the uvea, the retina. It can even travel back and cause meningitis and encephalitis if it's very, very severe. So it's generally recommended that if patients are feeling their eyes uncomfortable and they're starting to see a rash on their forehead, very important to get to an optometrist, family doctor, emergency department within 3 days, because the treatment is oral. And if you start the pills within the 3 days, it's going to be milder in terms of how much it progresses, how quickly it goes away, and it will reduce the risk of something called post-herpetic neuralgia, something where long after the virus is gone and the patient looks normal, they're still left with a very tender and sore scalp.
Thanks to Dr. Hutnik for all of her pearls of wisdom and great knowledge about eye health. And we have so many more questions to ask Dr. Hutnik. So she'll be back next month on our next episode to give us some more information about eyes. So until then, stay healthy.